haven't told you why we shy away from the areola. So I'll give you two huge reasons. And the two huge reasons are as follows. One is capsular contracture. Capsular contracture is hardness. And it's thought to be formed, well, we know that it's formed because the scar tissue around the implant is squeezing the implant, and it makes the implant feel hard, sometimes even as hard as a rock. Even though the implant itself is the same soft implant. It's crazy, but it's true. So we know that many cases of capsular contracture are caused by kind of low-grade infection. There are bacteria growing layers and layers on your implant, but they're not sort of evil enough bacteria that are going to give you an elevated white count, a fever. They're going to make actual pus happen, and you'll need an operation to remove your implant. They're not that bad, but they're bad enough to cause a chronic low-grade inflammatory response. Another word for what these things are is called biofilms. And it's a whole field of study that's about 30 years old that we don't fully understand. But if you have an IV line, if you have any kind of synthetic thing in your body, there's a very good chance that there are biofilms growing on it, and we become more aware. So anyway, those biofilms can cause capsular contracture, so we've learned to keep our incision away from the little nipple. Because just like my nose might be clean, and I can prep the skin around it, but inside my nose has bacteria because they have free passage in and out. The nipple's the same kind of thing. It has little ducts. So there are little bacteria inside the ducts. So even though you prep it, when you're doing an operation and touching and things like that, there are little bacteria leaking out that you can't see. So therefore, the no-touch technique in breast augmentation was developed in the last 15, 20 years, which means you're trying not to touch the skin, and you're trying not to touch the implant with anything like that you can help, like your gloves. The no-touch technique means we're not putting a scar under your areolas, and we are putting like a tegaderm, a sterile layer over your nipple and nipple areolar complex so that there aren't bacteria that we can't see leaking out during your breast augmentation.